Is that better?
Yeah, that's the one.
Okay, great. So everybody, so as Nigel said, I'm going to speak for about 10 minutes and then we'll save most of the time for questions, but I'm going to briefly say a little bit about why study infectious disease epidemiology, what's unique about this MSc programme, and why study this degree at the UCL Institute for Global Health. And then a few details about how this MSc is structured and what career paths it might prepare you for, and then we'll take your questions. So, of course, COVID has brought infectious disease epidemiology into the news and into everybody's minds over the last few years. But even before COVID, about a quarter of deaths globally were due to infectious diseases. And as infectious disease epidemiologists, we're concerned with who is affected by different infectious diseases, of course, thinking about globally vulnerable populations in terms of HIV, TB, and some other STIs, but also the infectious disease risks and more broadly in terms of antimicrobial resistance and new and re-emerging zoonotic infections and other challenges to infectious diseases such as climate change. And this MSc programme is an applied programme where we're looking at how what we know about infections and their epidemiology can be applied to understanding interventions for preventing or controlling infectious diseases and how those might be evaluated. And so thinking about what's unique about this MSc, we're thinking about controlling infections and their impact on human health and really thinking about the interplay between the pathogen, the host, the community and society. So sort of thinking about the different levels within which those interactions happen and how advances in technology, thinking about molecular tools, for example, to characterize genomes can present opportunities for us to understand and control infectious diseases, but also dilemmas, including ethical dilemmas about how these technologies are used and who makes decisions around those, what happens to the data that are generated by new technologies. This MSc takes a transdisciplinary approach. So the modules that you'll study on this MSc integrate basic science understanding of infectious diseases with epidemiological and statistical skills. And we really want to kind of get across to you this move from the interface between the microorganism and human health to thinking about socio determinants of infectious disease in the wider communities and the population health level. And so integrating thinking across fields and across methods. And here are just some questions which have arisen over these last years, thinking, for example, about SARS-CoV-2 and the types of questions that need to be asked in terms of infectious diseases and their epidemiology and understanding a novel virus and how it's impacting on populations and the different directions that can be taken in order to control its impact. So thinking about why study this degree at IGH at UCL. So there are diverse research programs in infections in the department. There are people working across HIV, TB, sexual health, hepatitis C, SARS-CoV-2, just for some examples, and also a diverse set of approaches, including molecular epi, observational cohorts, health service delivery, implementation science, people working at the interface between quantitative and qualitative methods as well. There are many strong international research partnerships in the department and researchers influencing evidence-based policy across their areas of work. And there's a vibrant cross-disciplinary approach. So we're coming back to this idea of it being an applied program. Really apply to the problems which are of most importance in infectious disease epidemiology, and close links with other UCL departments, including the Division of Infection and Immunity, particularly drawing on the basic science component of the programme. In terms of the structure of the MSc and career paths, so this slide just gives an overview of the MSc structure. So there are 5 core modules, 3 in term 1 and 2 in term 2. And these modules cover the fundamental epidemiological and statistical skills that we've talked about, also molecular epidemiology for infectious diseases, and thinking about applying epi concepts and statistical concepts to population health and infectious diseases. And then there are 2 optional modules, and there's a full list of these on the website, but there's some examples on this slide, which includes public health data science, economic evaluation in healthcare, digital health, evaluating interventions, and then the dissertation, which is 60 credits, so that's a third of the MSc, which is completed in terms 2 and terms 3. And the optional modules roughly align to 2 career paths, one which would prepare you to work as an infectious disease epidemiologist, requiring strong quantitative and data analysis skills. The other more aligned with international global health and policy work, but a broad range of options, and you can mix and match sort of across the 2. Major focus really on practical application of knowledge and skills to infection and population health problems, as I've said, and critical appraisal being a key skill which we look to support students in developing throughout to think through the way that problems are framed and research questions are formulated, as well as the study designs and the findings of those studies which are used to address them. And the MSc dissertation, so this is an in-depth academic investigation, and we support students to conduct projects which are in their own areas of interest with the support of a research supervisor in the department. And we're looking for students to complete original, relevant and critical work, and for this to be a bridge to the world of research, where you have the opportunity to apply the concepts and the knowledge through the taught modules to your own research project. And the aim is for some students to publish their projects. And each year we have students working on a wide range of policy relevant projects, including via links with the Africa Health Research Institute and also UK Health Security Agency. In terms of career paths, so Emily and Alice can tell you a little bit about what they've been doing following completion of the MSc. We have had, so the programme is now in its 4th year, and we've had graduates going into a wide range of positions relevant to infectious disease epidemiology. And this has included academic positions, so research assistant positions and PhD training programmes, also analyst or policy jobs in organisations such as the UK Health Security Agency or other national public health agencies. And we expect students to be competitive for jobs in international organisations as well, and some of those listed on the slides, and NHS and local authority public health teams, a wide range of possible options where infectious disease epidemiology skills can be applied. You can find out more information on the website. For the MSc, the department and UCL Institute for Global Health is on Twitter, and so you can follow there. There's also a paper which I've just snipped the link for on the slide, which explains some of the concepts around the teaching on the programme, which I'd recommend that you also have a look at to understand how the programme's kind of been developed and come about. Really happy to answer any questions. Our email addresses are on the slide there as well, so do feel free to jot those down in case you've got questions later on that you would like to email us. I'm going to stop sharing. And so if anybody would like to ask a question, you can either feel free to unmute yourself and and ask it, or you could type it in the chat, which you should all have access to at the bottom of the screen. If you're more comfortable doing it that way, that's also completely fine. While you're thinking of your questions, I think we might hand over to Emily or Alice if one of you is able to just say a few words about your experience on the programme or what you've been doing since you graduated. Is that okay?
Okay, I'll start. Like I said earlier, my name's Emily. I started on the AID program in 2019. Before joining the program, I'd done my bachelor's in molecular biology, so was much more focused on the lab science side of things, but was interested in moving more towards epidemiology and population health. So I thought that this program was a good fit for what I needed in terms of experience, so developing statistical analysis skills, but also still incorporating the molecular side of things. And I thought that this program incorporated molecular epidemiology in a way that many other public health and epidemiology master's programs didn't do. I am from the US, and so I was an international student coming to UCL, but have really enjoyed living in London. During the master's program, I really enjoyed all of the coursework. In particular, I think the stats courses were really useful in terms of developing those skills. For my dissertation, I did a project modeling the prevalence of hepatitis C in pregnant women in England, and I was able to go on and publish that work. Following on from the master's, I worked as a research assistant for a year on a project looking at the impact of the COVID-19 pandemic on sexual and reproductive health in Britain. And then after doing that for a year, I started on a PhD here at UCL in the Institute for Global Health. And the topic of my PhD is the impact of HPV vaccination in the UK. So I think I'll pass on to Alice now.
So yeah, I was in the same cohort as Emily. Before AID, I did physiology for my bachelor's, which was like med school hardship, except it's not in med school. And picking this MSc was more or less a random choice. It was a suggestion from a friend, and I Googled public health, and UCL just was first on the website, and I just thought it'd be interesting to bring in more of the human factor and see how diseases work in human society. So that's why I chose AID. And then after my MSc, I started working for GSK, a pharmaceutical company, on home digital health devices and services. It was initially about infectious disease. That was why I got the job. But then very far just strayed from that. And I was working on design work for more general digital healthcare products. So I worked there for half a year, and then I started thinking about doing a PhD because during my time there, when designing these products, I realized that, as a for-profit company, a lot of time these products only target certain populations, and there are a lot of people who are missing out on these wonderful services or just the most basic services provided online. So based on that, I developed my PhD project, which is about the role of telemedicine in healthcare access for older Chinese migrants in the UK. And also when I was doing my MSc dissertation, I came across this qualitative study, and it was really shocking to me, and I just found that qualitative research was so empowering, and that gave me the idea of doing a qualitative project for my PhD. So I'm mostly focusing on qualitative methods right now, and yeah, that's where I am now.
Great, thank you both. We're really happy to take questions from anyone here. You can ask us about the course content, about the kind of projects you might do, as well as about opportunities that come from the course. As Heather has said, it's not just PhDs, although we're really proud of the number of students who have done the AID program and gone on to do a PhD. The current cohort have teaching sessions at the moment, otherwise they would also be here to tell you about life in AID now. And while I'm thinking about that, we have now some, probably getting on for 100 alumni of the program, or will do at the end of this year when the current cohort finishes. And there's a fairly well-connected alumni network that's organised through LinkedIn that allows alumni to share job opportunities and keep in touch with each other, and later cohorts help current or more junior cohorts, if you like. And the other thing that has happened this year in particular, which has been really nice and I think will continue, is that students who've done the program and then either got research assistant posts at UCL or PhD posts are starting to teach increasingly on the program. So you get taught by some of the world experts in infectious disease epidemiology on the program, but also some of the tutors are students who've done the program recently, who can really understand the challenges of using this data and all of the difficulties of being a student on the course, and can give you advice about that, we hope. And that seems to have worked well on both sides. I'll stop there. We're really happy to hear questions. The other thing perhaps is that both Emily and Alice are overseas students who came, so they can talk about their experience of finding their feet in London and how that worked for them, if you've got questions about that. Yeah, really happy to hear from you. You don't have to turn your camera on, and if you don't want to talk, you can type.
And if you don't have a question exactly, but there's something that you'd like us to say more about, or just to give more detail on, then that's also fun. Thank you, Caitlin. We've got our first question. How many hours of classes, online or in person, do you usually have per week as opposed to independent study? So the program is delivered fully in person now, following the pandemic, when of course there were various adjustments that took place. In terms of in-person contact hours, so I'm just trying to add it up in my mind now for term one. I think it's around about 20 hours a week in term one. And there's also quite a bit of work to do in terms of independent study. Term one is the most intense in that respect. And then in term two, there's just the 2 core modules and an optional module, and starting to think about dissertation. So as the programme progresses, the balance between face-to-face contact and independent study shifts, and you're expected to do more independent study. And then of course, as we go into summertime and people are working on their dissertations, that is majority independent study, just with meetings with your supervisor to guide the work and to provide appropriate support. Does that answer your question, Caitlin? Feel free to ask a follow-up if not, or if there was something that you didn't think was covered.
I think that's helpful, Heather. I'd just say that if you're doing the course full-time, and there are part-time and flexible options, but if you're doing the course full-time, you should think of it as about the same amount of time that you would spend on a full-time job. Because if there's about 20 hours of face-to-face teaching, it's probably at least as much to prepare for that and do work that follows on from that, from the face-to-face teaching.
Thank you.
So the next question was, are there examples of previous dissertation project titles available? It's a good question. I think we can, so Alice and Emily have told you their dissertation titles. Just off the top of my head, I organised the projects which came from UKHSA last year. I think they had 4 students who were doing UKHSA projects. And the ones I can remember, there was one on using national surveillance data on syphilis to try and understand an epidemic of syphilis that's been expanding in the UK among heterosexual groups. And that's particularly of importance because the number of congenital syphilis infections, although small, have started to creep up in the UK, which is really worrying. Another student did a project on late diagnosis of HIV in migrants from South America, which was a project I think he hopes to publish because there's very little data available about that. Another student did a project on gonorrhea infection using surveillance data to understand and inform the current UK testing guidelines in men who have sex with men. And there was another UK HSA project on using a large database of hepatitis C treatment. Individual patients who'd received treatment for hepatitis C, trying to look at factors associated with not completing hepatitis C treatment, to understand how hepatitis C treatment services might be better targeted and organized to stop people falling through the gaps. And another student last year did a project a study of mine called Baby Biome Study, which is a microbiome-based study looking at factors associated with opportunistic pathogens in the gut of babies to try and understand more about the epidemiology of gut microbiota in very young children. So there's 5 examples, and I'm sure, Heather, if you want to add any others, but they're really all sorts, and students are able to choose their own topics as well as selecting topics that many members of staff offer when the time comes in the dissertation process.
And maybe I can just explain broadly that so there are different options for dissertations for the AID programme. So one option is a literature review, and another option is a data analysis dissertation. I think roughly about a third of students do a literature review and about 2/3 a data analysis dissertation. And of course, this is a quantitative course, and so even with literature reviews, there's lots of sort of thinking about the quantitative aspects of studies involved included in the review. But there's, as Nigel said, lots of scope for bringing your own ideas as well as for thinking through work that's possible using data sources within the department or available through potential supervisors in the department. So.
Okay, should we take the next question from Sayale?
Yeah.
Sayale? I'm very much interested in reproductive health, and there are a lot of people who work on sexual health and reproductive health in the department. So provided your interest is primarily in infectious diseases, that sounds great. I've applied for the course and received an email stating an update. Been more than 2 weeks, so I'm sorry that you haven't had that. We have had a few problems with admin and staff have turned over in the last few weeks, so maybe that your application has been caught up in a delay because of that. But I think what we can say is that we'll take your name away and have a look online on the back end to see where your application is. And if you want to drop Heather or I an email, I'd be very happy to follow up with you after this session, but we should be able to get your application moving through the system as soon as possible. So bear with us, sorry, and we'll get you a response.
I'm just going to put out emails in the chat in case you want to take them from there.
Okay, so the next question was from Holly. Could you talk a bit more about job opportunities after the Masters, please? Yeah, that's a really important question because we recognise that many of you may be doing this MSc as a stepping stone to future job career plans. And if we put to one side for the minute the fact that there are lots of PhD opportunities at UCL, within our faculty and department, we have good access to the MRC doctoral training program, which is a brilliant PhD program which Emily is funded through, and quite a few other sources of funding for PhDs. But if we put PhDs to one side for a minute, as Heather said, there are all sorts of opportunities for different career paths. Broadly speaking, they divide into people who want to be researchers and epidemiologists who are primarily kind of probably quantitative, having done the course that we providing. And so some students have gone on to get research assistant posts where they use the skills in the MSc to be very competitive to research assistant analyst type posts within UCL, within our department and faculty, but also in other universities and higher education institutions. The other place that many students have gone is to organisations like UKHSA, the UK Health Security Agency, or the national equivalent. So there's a student working for the Korean CDC, Chinese CDC, and other national disease control government-related organisations. Some students, as Alice said, have got posts within pharma organisations. The other sort of route is more policy-oriented organisations like WHO or ECDC, the European Centre for Disease Control, which we think the course also provides really good training for, because it enables, at the end of the course, you should be able to both design but also evaluate policies and understand how to make good policy based on the best available scientific evidence. I don't know if Heather and then perhaps Alice and Emily want to add anything to that.
Not really. I mean, yeah, we've got a broad range of jobs, I think, represented in our alumni, but the overall point is that the large majority have gone into jobs very focused on infectious disease epidemiology or otherwise quantitative or kind of policy focused work, and that's closely linked. And so it's been really good to see graduates from the programme being able to apply the skills that we've covered in this talk programme in those jobs.
Good. Alice or Emily, do you want to add anything? Don't have to, but if you have anything you want to add, feel free.
I think from our cohort, there were quite a few research assistants. Mm-hmm. Yeah. And I think almost every single person got a job somewhat COVID related.
Yeah, I think many who were in research or public sector, CDC, UKHSA, and then many have gone on, whether it was immediately after or eventually, to do PhDs as well.
Yeah, it remains quite hard to get onto a PhD program while you're an MSc student, and so while we have supported some students to be able to do that, very often students have been successful in getting a research assistant post out of the MSc, and then in that year getting onto a PhD program, which can work quite well.
Also, I don't think going directly from MSc to PhD is like good for mental health.
Yeah, you need a break.
Yeah, I would say for me, doing that, I worked as a research assistant for a year, and I think that helped me be better placed for a PhD than the master's alone, because you get to kind of put to work actually some of the things that you've learned during the MSc, which is really valuable.
Yeah, and really think about what you are interested in for the next 4 years if you want to commit to a PhD.
Yeah, PhD is a big commitment, and you need to know that you're going to be interested and enjoy what you're going to do. Good, thank you both. And then Sayali also asks, can we carry out different projects apart from the dissertation? I guess that means alongside, sort of in your own time, can you do projects? I think the short answer is that that's possible and that some students have done that. But I think might be go back to the first question that was asked about the amount of time it takes, and to really do well and get the most out of the MSc program, it takes a lot of your time. So while it's possible, it would also be important to prioritize the MSc.
I wonder, in response to this question, whether it's also helpful to say a little bit more about the other assessments on the programme, because we've talked about the dissertation, but maybe I can say a few words about the other assessments, which are kind of mini projects in their own right, really. And so there's a wide range of assessments that we have on this programme. They're on at least in terms of the core modules, they're all coursework, so there are no exams. There's assessments that require you to analyse data and to present that. So whether that be in the form of an outbreak investigation or analysing a data set for a statistics module. There's also more kind of essay-based assessments. There's an assessment where you're asked to come up with a proposal to tackle an infectious disease public health problem, which is a real life problem that you're asked to research and think about and then construct a proposal to address. I know for the molecular epidemiology module, the assessment is a critical appraisal. So you're reading a published paper and thinking through the strengths and limitations of the evidence that it presents. So these are some of the types of work that you'll do on the programme. And with quite a few of these assessments, although the assessment is obviously kind of carefully delineated, you can kind of do quite a bit of reading in your own time to understand different aspects, which can fit with your interests as well. So yeah, I'm happy to answer any follow-on questions about that. If you have any, just drop them down.
Okay, we'll take more questions, but the next one's from Botina, which is what sort of undergraduate degrees have students done coming into the program? I studied sociology and politics and science. Not sure if I meet the entry requirements because of my undergraduate. So there's quite a range of students who come to the program. Broadly speaking, they tend to fall into people who've done biomed type and basic science type MScs, and people who've done social science and quantitative undergraduate BSc programs. So Botina, it's hard to know for sure given what you've written, but I think if your application emphasizes why you're interested in doing a quantitative based epidemiology and stats focused MSc and why you're interested in infectious diseases, then I think it's very likely that you would meet the entry requirements. And feel free to drop Heather and I an email if you want to give us a bit more personal information about the experiences you've had in your rationale, and we'd be happy to either speak or just email. But I think you would meet the entry requirements. No, Heather, if you want to add to that.
Perhaps just to say that so there are 2 core statistics modules for this MSc, and this year for the first time these 2 core stats modules are bespoke for this MSc program. So previously they were shared with other MSc programs, and this year they're just for age students. You're not expected to have sort of prerequisites in statistics to take this program, to take those modules. So although this course is, as Nigel has said, is a quantitative course, and we're looking for people who are interested in applying their quantitative skills, you're not expected to come onto the program with a big background in statistics or to sort of have a lot of prior assumed knowledge, just to clarify that if that's helpful. Yeah, but really happy to answer questions by email about individual circumstances and study to date, etc.
And I think just adding to that, the way we've designed the course, we appreciate that many students come with some knowledge which is relevant to the course already, but gaps in their knowledge, and different students have different gaps. So what's quite nice, I think, is that the cohort sort of looks after each other and fills in each other's gaps. So there are some with really good basic science knowledge, and so the fundamental principles of infection and population health module, some of that content will be familiar to them, although often it's also expanding their knowledge. For other students, the stats course, they'll be familiar with some of the concepts, particularly in the basic stats, although in the context of infectious disease epidemiology, it wouldn't necessarily be all content that they would know, but have less knowledge about the basic science in medicine. So those, particularly the first term and some of the second term modules, try and make sure that everyone is on a level playing field and fill in gaps in different people's knowledge base. So with that, I think that's probably our answer to that question. So then Heather's put our email addresses. Sayeli, thank you so much. And then Alex Flint, hi Alex. I too waiting for applications. So I think the same advice as Sayeli, we'll take your name and follow that up with our admin team, make sure that your application is being processed. We did recently review all of the applications that were in the system, and so that any that are that were received at that time should be now being processed. So I'd hope you'd hear very soon. And thanks for letting us have your name. On a side note, I'm currently reading Infectious Disease Epidemiology, predominantly written by those at UCL, and it's got me really excited with the potential to study at AID at UCL. That's great to hear, and we look forward to meeting you in due course, hopefully if you take the program. And then the others are thank yous. Any other questions that people want to ask? We've got about 10 minutes, 10, 15 minutes. Yeah, go ahead, Heather.
I'm wondering whether this is maybe the time to turn off the recording in case anybody has any questions they want to ask off the recording.
Yeah, I'm going to pause the record in case there's anything that anyone wants to. So yeah, Alice or Emily, is there anything that you wanted to know at the start or before the start of the program when you're in the same position as?
Yeah, well, I think kind of going off what we've already been talking about in terms of coming from different backgrounds. I was coming in with a molecular biology background, and really, even though I'd done some calculus and maths as part of that degree, I had not done any statistics. But I felt like I was given, there were plenty of opportunities to develop those skills. And in terms of the workload, since I already had kind of the biology knowledge, it made it a little bit easier in the first term to focus then on the things that were genuinely new to me. And felt like, yeah, even though there were students who started off at this like a better stats level than I was, we did manage to get to more of an equal playing field by the end.
Yeah,
you had the same way.
I didn't have any stats background coming into this, but yeah, stats was fine. Yeah, we had all the necessary introductions. Yeah. One thing that I wanted to know when I just started was about the dissertation, because I didn't do one for my bachelor's. But I remember there was one session within the whole department, I think, about the dissertation and like the different types of things you can do. And I think that answered a lot of my questions.
Yeah, I felt like at the beginning there was a lot of good induction, orientation sort of activities to help us get ready. And also having such an intensive term one in terms of face-to-face coursework was kind of in the end a benefit, because you get to know your cohort very well, so that when you get to the more independent study part of the year, you have those people to reach out to. And in our case in particular, when we switched to being online in March, because that was when the pandemic hit, it was good that we'd already kind of built that bond with your cohort in term one through all of the face-to-face hours.
I think we've been really fortunate by how nice the cohorts that we've had have been. We've also got a size of around 25 to 30 students each year so far, which is kind of like a sweet spot of enough in the class for there to be really good discussions, but also small enough that the students and the lecturers and professors get to know each other quite well. And there's a kind of intimacy, so you can ask questions very easily in the context of a size of 30, which can be more difficult if there are compared to programs where we might have hundreds in the same room.
Yeah, actually, when I was, sorry, Nigel.
Yeah.
When I was looking at the master's, that was one of the reasons that I was really wanting to do this program as opposed to some of the other ones in IGH or at other universities, because of the class size and only having, I think we were, 15 in our year, so it's grown a bit since then, but compared to the other masters in IGH, it's probably at least half the size of the other programs. And so you get a lot more interaction with the professors and room to speak up and actually engage in the learning.
Yeah, so it was 15 in the first year, and then it's grown to 25 to 30 in subsequent years. Good. Any final questions before we close? Okay. Heather's and my emails are in the chat. I don't know, Emily and Alice, are you happy to put your emails in the chat as well, in case anyone wants to reach out to you guys to ask questions for former students? Great. Well, thank you all so much for excellent questions, for coming today, and so wish you really good luck in your applications. And we hope to see some, if not all of you, in September, starting the A program. We'd be really delighted if you join us. Thank you.
Thanks very much, everybody. Thank you.
Okay, bye.